the basic principles of tooth carving. It is no secret that tooth carving is the best method of understanding the tooth morphology, and everybody knows that tooth carving helps in understanding the tooth morphology, which comes very handy in clinical dental practice. The armamentarium required for tooth carving are: the first thing is the wax blocks. The wax blocks come in various colors and they are made up of paraffin wax, and the dimension is usually 4 cm into 1.25 cm into 1.25 centimeters. Next we need a metallic scale which gives centimeters and millimeters measurements. Then the carver, this is called lacron carver. The instrument is a two-sided working end, that means double working end is there, and this part is your handle and it is serrated to help in gripping the instrument. Then this part and this part is the neck of the carver. And the working end, two working ends are there. The first working end is called the knife shaped working end, which is having a blunt side and the working side, that is the sharp knife edge side, and this is the straight part of the working end, this is the curved part of the working end. For all practical purposes, most of the time we use the straight part of the working end, and this curved part is often used for occlusal carving. And this part, that is the spoon shaped working end, which is having a sharp the end of the spoon, that is often used only for carving the occlusal grooves and for lingual fossa. So these are the armamentarium. Now coming to what are the general principles of carving. Before tooth carving, we should understand two important things. One is instrument grasp, how to hold the instrument. If the operator is a right-handed person, then the instrument is held in the right hand and the block is held in the supporting or the left hand. Now, how we use to hold the pen, that is called pen grasp. This is a pen grasp, but for carving we use something called the modified pen grasp. How is it modified? It is modified such that enough pressure can be given with the pad of the third finger, which is held at the neck of the carver. So it is held like this. This is called modified pen grasp. So this is about the grasp of the instrument. How to stabilize the instrument, that is called instrument stabilization. Unless we have a stabilized hand, then we won't achieve the proper carving. For that, we use the remaining two fingers of the operating hand so that it can be rested on the fingers of the supporting hand or the non-operating hand. So this is how you hold the block, and with these two extra fingers of the operating hand, you just place on the fingers of the other hand so that you rest. So this is called finger on finger rest, or sometimes we can rest on the block itself while carving. So this is called finger on block rest. So we use finger rest for stabilization of the instrument. So before carving any tooth, there are some things to verify, and first thing is we should check that all the surfaces of the block are smooth and they are not having any air bubbles. Now some preliminary markings can be done before. This applies to all tooth carving, whether it is we are carving the incisor, canine, premolar or a molar. First we measure the crown of that particular tooth we are going to carve and mark this part becomes the crown part, and the root length we mark, and this part becomes the root part, and the remaining part of the block becomes the base. So we extend the length of the crown on all the surfaces and length of the root on all the surfaces, and this becomes the root part, and the remaining part is our base part. And labial surface, lingual surface, mesial and distal surfaces are marked on the base of the block. It is marked like this. Then it is a good practice to mark midline on all the surfaces like this. And when we come to the crown, it can be divided into 3 parts. So incisal or occlusal third, middle third and the cervical third. Again, it can be extended on all the surfaces. Now the block is completely ready for beginning of the carving. So these are about the basic principles of tooth carving.